There'll be a brand new curriculum available to OSU students returning to campus in the fall, a first ever 4-year degree in nursing. A similar program already exists at OU and a few other state schools, and together the aim is to finally fully address the nursing shortage in our state. Steve Shaw joins us now with a progress report. Steve.
Rich, the Sooner State ranks in the bottom 5 nationally when it comes to the number of licensed nurses available for the state's population. Last year, the state legislature allocated millions of dollars to address it.
So do a head-to-toe assessment, and just like you would normally.
Duncan Regional Hospital, 75 miles south of Oklahoma City, offers a paid summer internship for nursing students who just completed their first year.
So what brings you in today, Miss Aubrey?
My leg is hurting.
Nursing school generally takes about 2 years to complete. The students we talked to last week at Duncan Regional say they plan to work there.
This will be a second career of mine. I have a bachelor's degree in business, and I'm coming back and doing a full circle back to healthcare and fulfilling a dream.
Growing up, I helped in my grandparents' care. I seen them get really sick and the hospice nurses coming out to help them.
Duncan Regional CEO Jay Johnson says this hospital averages 80,000 emergency room visits a year, and there are generally 55 beds in use each day. The coronavirus pandemic 3 years ago caused nurse burnout, not just here, but everywhere. Nursing shortages force hospitals to use what are called temporary contract or traveling nurses to fill the holes. The catch is, Johnson says, they cost 3 to 4 times more than a regular nurse. Right now, Duncan Regional still operates with 46 contract nurses on a nursing staff of just over 300.
Explain to people why getting good help is harder in these rural hospitals.
Well, there's fewer people in our rural communities, so you have fewer people that are trained to do the jobs that we have.
Kristen Webb is Chief Nursing Officer at Duncan Regional. She says one reason Oklahoma lags behind other states when it comes to the presence of capable nurses is because it costs a lot to offer nursing programs.
It's not just every university and every college that we have available in Oklahoma, and particularly in the rural areas, have nursing programs. So if there was additional funding for education and faculty for the nursing programs in our state, would go a long way to helping us improve this shortage.
Duncan Regional already partners with the University of Oklahoma to attract and train nurses. And when we were there last Wednesday, the hospital also announced a partnership with Murray State College in Tishomingo. And this fall, for the first time ever, Oklahoma State will offer a 4-year on-campus bachelor's degree in nursing.
We have had traditionally, honestly, hundreds of students each year inquire about a Bachelor of Science in Nursing. There's a real desire about coming to OSU, coming to be part of this nursing profession, and so we've just felt very fortunate that we're able to develop this program, really recruit not only from Oklahoma, but certainly surrounding areas.
Dean of Education and Sciences John Peterson says OSU will start with around 50 nursing students this fall, then grow it by 100 each year.
My philosophy as a dean has always been think big, start small, learn fast. And so we want to make sure that we get it right.
Oklahoma Career Tech received $14 million in federal pandemic money 6 months ago to expand their nursing programs. But Health Careers Manager Laura Morris says issues linger.
Those students that were in high school 2 and 3 years ago during the pandemic, we're now seeing that they may not have the academic preparation that's necessary to be successful in nursing. We can open the doors to as many students out there. That's not a problem. But to have someone that has the math, the science, the communication and English skills that are necessary to be successful and to pass the national board exam, that's a whole different thing.
OU College of Nursing Dean Dr. Julie Hoff says come this fall, OU will have graduated 372 undergrad and 31 graduate nursing students this year.
But what we know is if the face of the healthcare provider matches the face of the patient, you get better outcomes. And so when 80% of nurses are female, large proportion of them are Caucasian, we're not achieving the same outcomes we could achieve if we had more Native American nurses and more Hispanic nurses and, more African American nurses, as well as more male nurses in each one of those groups.
Nurse Anna Doan just graduated from OU in May.
I've had health experiences in my life where I've been in the hospital, as well as a couple of my family members, and the one person that you always know you're going to have on your staff, at least see every couple of hours or even every hour, is a nurse.
Anna says she has accepted a nursing position with OU Health in their adult intensive care unit.